So welcome back, Dr. Young. Why don't you tell us how'd you hear about our office?
I'll be honest with you, my wife found your office, although I have always been open to alternative care instead of purely allopathic care, meaning allopathic, I mean MDs or DOs, and alternative meaning chiropractors and other naturopaths and so forth.
Yep. Because you are a MD, you're a medical doctor.
I am a medical doctor. I'm a radiologist specifically. And,
Okay.
I inquired with one of my internal medicine physicians how would they take care of the numbness and tingling, and mostly that. I didn't really have pain.
Okay.
Numbness and tingling in my toes, and a little alteration in my gait as well. And they said, well, we would probably put you on anti-seizure medications. I said, whoa, no, I'm not going that route, because any kind of medication, especially anti-seizure medication, is fraught with a lot of side effects and complications.
Okay.
So my wife, who's always been very interested in alternative medical treatments, looked into it and found your clinic, your office, and so I said, well, let's do it. Let's find out what they can do for my feet. And
so you
even though I was a little bit skeptical at the beginning, I said, let me try it, because I certainly do not want to take drugs.
Yep. So you went through our neuropathy regenerative care program. You went through the 4-month program. What have you noticed change in your neuropathy since?
In the first 2 months, I really didn't sense much change, but the third month I started seeing an improvement, and I'm really happy to report that by the 4th month, as best as I can estimate, it's been at least an 80% improvement.
Excellent. So it took some time to get there.
Yes, it took some time, and I knew that this was not going to happen overnight.
Correct.
And I rarely, maybe once or twice a week, I feel numbness and tingling in my toes. Generally on the weekend, when I lay around in bed deciding whether I should get up or not, then I feel a little numbness and tingling. But once I get up, that is gone, and my gait has certainly improved, although in my age, nothing is 100%.
Yeah.
So I expect a little slowness in my gait and so forth. But the best I can estimate, I have had at least 80% improvement.
Okay. And one thing patients always ask me, which it might be good because it's coming right from you, somebody who is a medical doctor. One of the questions patients will always say is, well, why didn't my medical doctor or why didn't my neurologist tell me about this type of program? So maybe you give your experience, like when you're going through training and when you're going through medical school, do they talk about any type of alternative therapies at all, or do they pretty much just, you don't even learn about any of it?
Well, unfortunately, say even when I went to medical school years ago and currently, there is no education regarding the type of treatments you do. In fact, there's also no education about nutrition. Physicians, MDs, know nothing about nutrition. They know very little about this type of care that you do, Adam. So we are, I mean, hate to say it, we're ignorant.
Yeah.
And so
it doesn't mean that the program can't work for the patient. It just means that maybe the prospective patient's doctors just aren't aware of what it is. Therefore, they're not making recommendations because they've never really heard of it, or it's not something that they would do either.
Precisely. They don't know anything about it, so that's why they tend not to recommend your type of approach. Unfortunately, insurance companies probably don't pay for this kind of treatment, and it's too bad about American mentality that if something is wrong with your car, they take the car to the mechanic even though they have no insurance to cover for it, and they will pay readily to fix their car.
Yeah.
But they will never do that, or almost never do that, with their own health, even though insurance companies will probably not pay for it.
Yep.
But that, it's the American mentality that we expect somebody else to pay for our health issues. And that's something that really needs to change over time, but unfortunately it probably won't.
Gotcha.
Because that's how we've been doing it for a long time. Either our employers' health insurance will cover it, or Medicare, or somebody.
Okay.
Except we hate to pay physicians or chiropractors or any other healthcare practitioner for our health. We expect somebody else to do it
Okay.
for us.
So what would you tell any patient that has neuropathy? What would you recommend they do?
Well, I would share my experience with your office and with your treatment, and just say that this worked for me and it works for other people, and I think you should try it. Anti-seizure medication is probably not going to help you, and it's
Like a gabapentin or Lyrica?
yes, and now it's fraught with significant side effects and probably complications that I do not want to put up with.
Gotcha.
I mean, it's better now that I already take medications, and of course I take a lot of supplements as well. And importantly for the type 2 diabetic, to keep their blood sugar under control. That
Yeah.
is critical here.
Perfect.
And I had to change my diet. My blood sugar was not completely in control, but I had to be serious about my diet, and that helped. And I do take some supplements for blood sugar control, and that I think has also helped.
Good. Anything else?
No, I am really grateful to you, Adam, and your office for helping me with my medical issue and problem, and I
welcome.
certainly will recommend you in a heartbeat. So,
Thank you.
thank you.